Welcome to the Am I Mental podcast, where we discuss real life cases at the intersection of mental health, medicine, and the law. My name is Dr. Sabine Thompson, and today's episode is part of our Doctors in Court series, where we explore the trials and challenges doctors face in their actions in the course of this episode, I'll walk you through the timeline of events, the plaintiff's accusations, the cardiologist's defense, and the final decision by the disciplinary board. I'll also explain some medical terms and end with two questions for reflection. Let's get started. Let's begin by outlining the key events in this case, which took place over several years. December 2004. Sarah, our patient, suffered a minor stroke and was referred to Dr. James, a cardiologist, to rule out any heart-related causes. Sarah visited Dr. James during the newly introduced walk-in cardiology clinic. During her visit, Dr. James conducted an ECG, a test to check heart activity, and ordered a chest X-ray to check for any abnormalities. Later in December 2004, Sarah returned to Dr. James with her X-ray, but the radiologist's report wasn't available yet. Dr. James reviewed the X-ray himself and informed Sarah that everything appeared normal. He sent a report to her general practitioner, stating that no abnormalities were found in her heart or lungs. However, a follow-up procedure called a transesophageal echocardiogram, a TEE, was scheduled to investigate further. March 2006, nearly 15 months later, Sarah experienced worsening symptoms, including a persistent coughing and fatigue. She was referred to a pulmonologist who discovered that she had a non-small cell lung cancer, stage 3A, that they had likely been visible on the 2004 X-ray. Upon reviewing the radiologist's report from 2004, Dr. James realized that a potential issue had been flagged, a shadow near the aortic arch, that warranted further investigation at the time. However, the report was never acted upon. June 2007, Sarah wrote a letter to Dr. James asking why the radiologist's 2004 findings weren't brought to her attention earlier. Dr. James responded 6 weeks later with an apology and explained that he had not reviewed the radiologist's report at the time. This delay led Sarah to file a formal complaint against Dr. James claiming negligence. That brings us to the complaint filed by Sarah. Let's take a closer look at the accusations she raised. Sarah's complaint included two key accusations. Number one, negligence in reviewing the radiologist's report. Sarah argued that Dr. James had failed in his duty to properly review the radiologist's findings from December 2004. The radiologist had noted a potential abnormality, a shadow near the aortic arch, that required further investigation via a CT scan. However, Dr. James never followed up on this report, and Sarah only discovered the cancer when she was referred to a different doctor over a year later. She claimed that if the issue had been caught earlier, her treatment options might have been less invasive and the cancer might not have progressed to stage 3A. Number two, delayed response to patient's concern. Sarah also accused Dr. James of failing to respond in a timely manner to her inquiry in 2007. After she wrote to him asking for an explanation, it took 6 weeks for him to respond, during which time her condition worsened. Sarah argued that this delay demonstrated a lack of professional accountability and respect for her concerns. And these 2 points formed the foundation of Sarah's case against Dr. James. Now let's turn to Dr. James' defense. Number one, defense regarding the radiologist's report. Dr. James acknowledged that he did not follow up on the radiologist's report from 2004. He explained that at the time, the hospital system did not automatically alert physicians to new radiology reports. He admitted that while he reviewed the X-ray himself and saw no abnormalities, he should have actively sought out the radiologist's interpretation before making a final decision. However, he also argued that the radiologist's note about the shadow was vague and not a clear indication of cancer. Dr. James maintained that even if he had not seen the report, it may not have changed the course of Sarah's treatment immediately. Dr. James apologized for the delay in responding to Sarah's letter in 2007. He explained that he had been on vacation when the letter arrived and was not aware of it until 6 weeks later. Upon reading it, he responded immediately, offering an apology and an explanation. Dr. James expressed regret for the delay, but argued that it was not intentional and was not due to personal circumstances beyond his control. Number 2, defense regarding the delayed response. Dr. James apologized for the delay in responding to Sarah's letter in 2007. He explained that he had been on vacation when the letter arrived and was not aware of it until 6 weeks later. Upon reading it, he responded immediately, offering an apology and an explanation. Dr. James expressed regret for the delay, but argued that it was not intentional and was due to personal circumstances beyond his control. Dr. James' defense centered on the idea that while mistakes were made, they were the result of systemic issues at the hospital and not due to deliberate negligence on his part. Now, let's look at how the disciplinary board reviewed the case. Number 1, negligence in reviewing the radiologist's report. The board determined that Dr. James had a responsibility to review the radiologist's report before informing Sarah that her X-ray was clear. While the hospital system at the time was not optimal, the board found that Dr. James, as the requesting physician, should have followed up on the report. The board ruled that Dr. James' failure to act on the radiologist's findings constituted a breach of his duty of care, as it delayed Sarah's diagnosis and treatment. Number 2, delayed response to patient concerns. The board acknowledged that Dr. James' delay in responding to Sarah's letter was unfortunate, but did not find it to be a significant factor in the overall case. They noted that Dr. James' apology and explanation was appropriate, and while the delay was regrettable, it did not amount to professional misconduct. Final ruling. The board ruled that the complaint was partially valid. Dr. James was found negligent in failing to review the radiologist's report and follow up on the potential abnormality. As a result, the board issued a formal warning to Dr. James, emphasizing the importance of thoroughness in reviewing radiological reports. However, no further disciplinary action was taken. Now, let's break down some of the medical terms that were central to this case. An ECG, or an electrocardiogram. This is a test that records the electrical activity of the heart to detect heart problems. A TEE, or transesophageal echocardiogram, is a specialized ultrasound that provides detailed images of the heart structure, helping to identify any abnormalities. Non-small cell lung cancer stage 3A. This is a type of lung cancer that has spread to nearby lymph nodes but hasn't reached other organs, and treatment options vary, but early detection often improves the prognosis. Radiology reports and physician responsibility. In this case, the radiologist detected a potential abnormality, a shadow, on Sarah's X-ray that required further evaluation. It's the responsibility of the requesting physician, in this case Dr. James, to follow up on radiological findings before making clinical decisions. These concepts were key to understanding why Dr. James' failure to act was seen as negligence by the disciplinary board. As we come to the end of this episode, I want to leave you with 2 important questions. Number 1, how should doctors balance their reliance on hospital systems with their personal responsibility for patient care? While hospital systems and technology are essential tools, I think that doctors ultimately do bear the responsibility for patient care. Even if the system is flawed, it's important for physicians to take proactive steps, such as following up on reports and ensuring that no critical information is overlooked. And personal accountability remains key, even in complex medical systems. What should be the consequences when a doctor fails to follow up on important diagnostic information? In cases where a doctor fails to follow up on critical diagnostic information, consequences should be proportional to the potential harm caused. In Dr. James's case, a warning was deemed appropriate because the delay in diagnosis did not appear to result in irreversible harm. However, Had the failure to follow up resulted in more severe consequences, stricter penalties such as suspension or revocation of medical licenses might be warranted. Thank you for joining me on this deep dive into legal accountability and the complexity of cardiology